Yes, some minutes ago we did tell una say we go join Dr. Bat here in order to be able to discuss issues pertaining to health, that is health matter. Health shekoko, health na wealth. Person wey get health, our people talk say you get everything. So on that premise, I say good morning once again and I welcome you to Health Matter. My name is Never Change Chief Olododo alongside Slimmy T. We go do am with Dr. Bat. Good morning, sir.
Yeah, thank you, Chief.
You're looking good.
Thank you very much, sir. So pleased to be with you this morning.
Really
Slimmest
nice.
of them all.
Doctor.
Your hair do.
Eh? Thank you so much. Yeah,
Always
yeah.
looking
I'm
lovely.
trying to be like you, and then you came with my color. Everyone that knows me knows I love wine. I don't go wrong with wine and black. So
Fantastic.
this looks very
Fantastic. Yeah. Good morning, viewers at home and around the world. We're happy to be back this morning. My name is Dr. Bath Tochukwu Febunam. I'm the medical director of Grace Valley Medical Center. As a matter of fact, we would have been continuing with the topic we started last week, talking about breast cancer. But because of the ongoing active outbreak of gastroenteritis, talking about infectious diarrhea, we decided to do justice to the topic this morning so that people will have the right information. A whole lot of junks are out there in terms of information, misinformation, and disinformation on what one needs to do, of course, when you're presenting with those symptoms. So this morning, we have an opportunity of hearing or of learning a thing or two that you can do if you're caught up with such symptoms that we can see as the topic goes on or as the presentation goes on. Number one, as we always do, we'll make a definition of what gastroenteritis is all about, okay? Forget about the big medical name. In a way everybody can understand. Another name for it is infectious diarrhea. Infectious diarrhea. We all know what diarrhea is in this part of the world, okay? So we're going to give a definition, look at the causes, look at the diagnosis, look at the presentation, prevention, and of course, if we have all the time, treatment, okay? So I'm sure some of us may have read or heard on the news about the outbreak, recent outbreak of gastroenteritis in some parts of Lagos.
Yeah.
We took the news?
Yes. The Honorable Commissioner of Health, in the person of Professor Akin Abayomi, gave the information that so far over 400 cases have been recorded. And out of these 400 cases, unfortunately, 11 people didn't make it. So he has killed about 11. And a whole lot of people have been treated and discharged home. Okay, so this morning, we'll be looking at gastroenteritis so that you actually know what to do as a mother, as a father, if your child comes down with some of these symptoms. Okay, so what is gastroenteritis? Two words combined together. Gastro has to do with the stomach. Enteritis has to do with inflammation affecting the GIT. Okay, so infectious diarrhea or gastroenteritis can be defined as a medical condition that is characterized by stooling and vomiting, often as a result of an infectious agent. Okay? That is to say that gastroenteritis can be caused, there are non-infectious gastroenteritis and there are infectious gastroenteritis. But this morning, we are concerned with infectious gastroenteritis. What causes gastroenteritis? Some other people may choose to refer to it as food poisoning. We'll hear that a lot, okay? Now, gastroenteritis may present with stooling and vomiting. Oftentimes, it could be only stooling, that's diarrhea, without vomiting. It could also present with abdominal cramps or abdominal pains. Sometimes, it could present with fever. The child or the patient or the person may have raised temperature, which we refer to as fever. Apart from fever, the stool too could become bloody. If that happens, the name changes to dysentery. Okay, so you can see they are interconnected. Now, why is it common? In 2015, for instance, over 2 billion people were affected globally by gastroenteritis. And the affectation is on a global scale, but is more prominent in third world countries where you have poor sanitation, where you have poor sewage system, poor waste management or waste disposal, and other indices that can actually help along that line. Now, gastroenteritis is important because of the high, it's actually very contagious. If you have a child who is stooling and vomiting, what you need to get infected is getting in contact with those fluids that are coming out of such a person's body. Once you touch those fluids and you mistakenly touch any part of your mouth, you can actually pick up the disease. Suffice to also say that most of the people that may pick up this disease may not even present with any symptoms. Okay, so in some situations, it could be self-limiting, meaning that it can go on its own. Okay, so this takes me to causes of gastroenteritis. Most of the causes of gastroenteritis is actually viral, meaning that most of the causes are from viruses. Okay, 70% of the causes of infectious diarrhea, otherwise known as gastroenteritis, is of viral origin. About 18 to 20% could be of bacterial origin. Now, when we are talking about virus, the most significant virus that causes this disease is called rotavirus. And this rotavirus has, thankfully enough, the rotavirus has a vaccine. Okay, so it can be vaccine preventable in most of our children. Suffice to also point out that yes, the vaccine is a special vaccine, the cost is not friendly. I must point out that. Okay, now the cost in Nigerian hospitals will hover between 10 to 15,000. So you can see affordability could be a challenge. Okay, talking about rotavirus vaccine. Okay, so since I've mentioned it early enough, usually a child should have, there are two licensed versions that are used. WHO declared it safe, and the safety was confirmed in the year 2009 and by WHO, and WHO has authorized and recommended its use in children and infants all over the world. There are two licensed versions of this rotavirus vaccine. There's one that is called Rotatec, RV5, and there's the one that we have, the common one we have in our environment there is Rotaris, RV1. Usually for Rotaris is given as 2 doses, okay? A child must have the first dose between 6 weeks to 15 weeks of life. The child must at least receive the first dose. And 2 months after, the child should have a second dose, depending on the type of vaccine that you're doing. But if you're doing the RV5, the Rotatec, it's usually 3 doses. 2nd month, 4th month, and of course, 6th month of life. Okay, it's advised that every child should have the immunization done before the age of 8 months. Okay, that's about the commonest cause of diarrhea in children. Okay, so also, if you have a population in which you have a lot of children that are immunized, it will also help to bring down the level of affectation in such a population, because people who are immunized will be prevented from having it, thereby short-circuiting or stopping the spread. As contrary to what one may have in a population where you have 90% or more of the children that are unvaccinated, okay, it can easily be transmitted from one person to the other. Remember I said that it is highly contagious. It can easily be passed across from one child to the other by just coming in contact with the body fluid or the stooling or the vomitors that are coming out from such an individual. Okay, so we've talked about the presenting symptoms or the presenting complaint you could have in such a child. If you have a child who is stooling and vomiting, usually when vomiting sets in, treatment becomes difficult. Otherwise, mothers have been educated on what to do. When you have a child that is stooling and vomiting, a lot of us in this environment will start giving flagyl, syrup, metronidazole. Sorry, I mentioned the brand name, but of course I have to do so that people will understand what I'm talking about. Do not give your babies that are stooling and vomiting syrup, metronidazole, okay? Now, the reason why you shouldn't give is, number one, in 70% of cases, the causes are viruses. So, they're not bacteria. So, your metronidazole will do nothing. Also, the other reasons why you may not give that. Number one, Number 2 is that it will not benefit the child. Okay, and it can actually stop the child from stooling. Okay, so it can actually stop the child from stooling. If it stops the child from stooling, it can create another complication, abdominal distension. That's usually why we don't stop a child that is stooling. We don't give any medication to stop the stooling in a child. It's long believed that the pathogens that are causing the problem, the body is trying to get rid of it out of the system. Okay, so if you're stopping it, you're not helping the body. So the mainstay of treatment should be rehydration, rehydration, rehydration. And that you can do at home with ORT, which is a combination of water, salt, and sugar solution. Thank you very much. You're a potential mother, so I'm not surprised you know all of that. Also, you could also add zinc supplementation to the medication. That will help to reduce the incidence of diarrhea, okay? And also that will help to reduce the duration of the stooling, but do not give any antispasmodic agent with the intention of stopping the diarrhea in such a child, okay? So we mentioned some of the symptoms that you could find in such a child, okay? Usually, for mild to moderate infection, you may not need to take your child to hospital so long as the child can tolerate ORT that you can give at home. But in a situation where the child cannot tolerate and it becomes severe, you have to take the child to hospital as soon as possible. Why? Because if you allow the child to continuously vomit and stool, dehydration will set in within hours. Okay, so that brings me to incubation period. When we pick up this infection, the onset of symptoms could start from as early as 6 to 12 hours to about 48 hours. Depending on the causative organism. If it is of viral origin, if you don't do anything and you keep doing rehydration for this child, over time it will wear off, usually within a week to 10 days. In some situations, it can equally persist. Okay? Now, when we talk about bacterial causes, we are looking at a number of organisms here. Okay? Escherichia coli, E. coli, Campylobacter jejuni. Forget about those names. Those are some of the bacterial causes that can cause this condition in children. And I said at the beginning that bacterial causes are responsible for about 18 to 20% of cases. You could also have other infectious agents like parasites and fungus also causing infectious diarrhea. Okay, there's also non-infectious diarrhea, in which case you could have things like the use of drugs, like non-steroidal anti-inflammatory drugs, okay, can actually, apart from the use of purgatives that are known to cause such problem, the use of non-steroidal anti-inflammatory drugs can actually, some of the painkillers, most of the painkillers we have in this environment can actually predispose one to that type of condition. There are some differentials too that could also, some infective condition that could also mimic the presentation that we have for gastroenteritis. Acute appendicitis in some cases may present with stooling and vomiting in children or even adults. Okay, so this morning our mainstay of we will be looking at what we need to do, in the sense that prevention is what we are going to hammer on. Okay, so as a mother, how do you prevent your child from getting infected with gastroenteritis or infectious diarrhea? If you're a mother and you have a number of children in the house, if one comes down the disease, what do you do so that you don't eventually have everybody in the house or all the children in the house coming down with the disease at the same time? Okay, so that is why we are here for you today.
Okay, I think on that premise, we need to go on this short break. We will be right back. Please go nowhere.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top we health matter. You fit also advertise your product and services on top we show where dey help people. Terms and conditions apply sha o.
Okay, you're welcome back. We still dey talk about infectious diarrhea, as Dr. Bat don give us the analysis from wetin e mean to the causes and wetin dey even cause am. Well, I'd like us to quickly open the phone line so that una sef wey dey house go fit call in to ask questions. We get to do wetin we dey discuss, baby.
Okay, guys, so feel free to talk to us. Remember, say, Doctor, we just want to enter the prevention mode, and I know say everybody just dey wait for that period, to know how we take prevent. And they say prevention is actually better than cure. Okay, so 08105434985, and of course 08173147589 be the two numbers we will give now to call us on top this morning. Doctor.
Okay, Dr. But before we actually move forward, there are some questions I penned down which I feel will be of good use to us.
Please go ahead, sir.
The gastroenteritis. Gastroenteritis. Is it the same thing as cholera? Because even when you call them infectious diarrhea, the word diarrhea will come out there. I know, say most of us know they always talk, say dysentery and diarrhea, they common to cholera. So can we call this gastroenteritis? Can we call it cholera? That's the first one. Then, should we do it one by?
No.
Okay, the second one, when you say part of the symptoms, stooling of blood, I've seen in cases where some adults stool blood, and they tend to liken this to acute pie. So can we say acute pie can lead to stooling of blood, or whenever you see such symptoms, it is gastroenteritis?
Thank you very much for those medical questions.
You're welcome, sir.
From my e-doctor.
You're welcome, sir.
Okay, so that was on a lighter note. Now, is gastroenteritis the same thing as cholera? The answer is no. Okay, but the presentations are similar. The signs and symptoms are similar, though with some little variations here and there. Now, cholera is caused by an organism known as Vibrio cholerae. Okay, now cholera too can present with stooling and vomiting, but it's usually a more severe disease when somebody comes down with cholera. Okay, so another major thing I would like to point out is that just like rotavirus has a vaccination, the commonest causes of diarrhea in children is rotavirus. It has a vaccination against it, okay, which of course I mentioned earlier that it's a viral infection. Cholera too has a vaccine, but the vaccine for cholera is not as effective. So the WHO and in America, they don't usually recommend that. Now the reason is that it can only last for some few months, okay? So, but by and large, there are a number of similarities between these two disease entities or these two clinical conditions, in the sense that in both of them you will find stooling and vomiting. And of course, if untreated within minutes, within a few hours, if it's untreated within a few hours to few days, dehydration can set in. And of course, it's a cascade of reaction. Once dehydration sets in, if it becomes severe, it will affect the kidney. So such a person can actually have acute kidney injury, otherwise known as acute renal failure. If we can remember that.
Yes, of course.
Okay,
to the blood stooling.
Now, to the passage of blood in stool, we refer to that as hematochezia. Okay, passage of blood in stool. It can occur in a number of medical conditions. Okay, the commonest, as we are talking about today, it can occur with dysentery. The commonest I mean does not mean in terms of presentation. Okay, so people who have hemorrhoid, pile, just like he pointed out, sometimes could have that happening. Okay, now for the elderly, if an elderly person, in medicine, when we talk about elderly people, we usually look at people who have attained the golden age of 60 and above. Those are the ones that we refer to as elderly. Now, if an elderly person is presenting with passage of blood in stool, it should be very worrisome. Okay, it's a source of concern, because colorectal CA can actually present with passage of blood in stool. Okay, there are other medical conditions that can actually cause passage of blood in stool in much younger age group, apart from pie that you mentioned. The number of them, okay, apart from pie, the person could also have traumatic injury to the anus, which could occur as a result of passage of hard fecal matter, okay, which can, in such situation, it could give such a person what we refer to as fissure in ano, okay, so it breaks the covering, the epithelial covering of the anus, and of course that can bring some degree of bleeding. So it's not only gastroenteritis, it's not only dysentery that can bring about passage of blood in stool? Thank you very much for those questions. Now we're looking at transmission before we go to
preventions, you mean?
Yes, yes. No, let's start with transmission before we move to prevention. Now, how do we get this gastroenteritis, infectious diarrhea? Remember at the beginning I said it's very, very contagious, okay? We can get them by a number of means. In children, people who do bottle feeding, okay? In some places, they regard it as baby killers. I'm talking about feeding our infants, our babies with feeding bottles. It's no longer advised.
So
now,
they use spoon?
Yes, cup and spoon. Now, get a cup if you're a nursing mother that your hand can enter comfortably. Have a special sponge, a special soap that you use to wash the spoon. Wash them, have multiple cups and multiple spoons. Wash them and ensure that they're kept dry. Have it sealed in a secured environment so that dust can actually not get into it. But if you're in the habit of using feeding bottle, I can tell you that no matter how you try, it may not be hygienic enough. Now, the reason is that usually for feeding bottles, the lower border, the ring at the bottom, okay, usually the brush, the type of brush that we use to try to clean them does not get into such ring. So you could have a feeding bottle and you're putting a brush to wash it. It won't get to those rings. And those ones will keep retaining food particles that can encourage microbial growth. Even without your knowing. Remember, we're talking about microorganisms here. So some of these things are not visible to the naked eyes. Okay, so if you're in the habit of using feeding bottle, either to feed your baby with infant formula or with water, please, this is the time to stop, okay? It can actually give your baby gastroenteritis. Apart from that, washing of hands. When you feed children, you're coming back from a trip and your children are hugging you all over and you're bringing out snacks and you're handing it over to them without remembering to ask them to go and wash their hands. Whatever they grab with such hands, if they've come in contact with their friends in school who may be having this condition, they can easily contaminate the food that you handed over to them. And of course, when they eat it, they will come down with those symptoms. When you eat uncooked food, unpasteurized milk, seafoods that are not properly cooked, okay? The consumption of fruit juices too, okay, will come into play. Okay, salads too. Thinking about foods that we don't usually cook, these are avenues through which we can get some of these complications. Remember, just like the avenues through which one can actually get typhoid as well. We have Johnson from Oyo. Johnson, good morning.
Hello, Johnson. Good morning.
Hello.
Okay.
Yeah,
good morning, Johnson.
Yeah, good morning.
Good morning. He's gone.
Yeah, good morning, doctor.
Yeah, good morning, my brother.
Yeah, the topic today is very nice. So, and we thank you for bringing it up today. It's something to worry about in the state presently. We really appreciate it. So, sir, like you said earlier on, you said, how do we prevent such a thing right now? As in, since now it's occurring faster, how do we go about preventing it? Like, what are the steps we need to take to prevent such thing? You've been mentioning it, but those ones are still, when I say like student outside now you've been attending to the ones in-house, like outside. How do we tell our young ones to avoid such things like that?
Thank you very much for that very important question. Now, the prevention will have to do with personal hygiene, personal and community hygiene. Permit me to also point out that sometimes this disease entity could be seasonal. We're in the rainy season now, and we know what our environment is, okay? Usually, you have people passing feces. Some houses have their soakaways channeled into the gutter.
Yeah.
These are not ideal. Whenever it rains and the whole place is flooded, the flood can get to any destination. It can get to some of our little farms that we have in and around our homes. Okay, so when you have flood or water body that have been contaminated by some of these infectious agents, okay, when you have them, when we go to where we plant our vegetables, after it may have rain and then flooded and all whatnot. And then you pick up some of these vegetables and the next moment you're using it to make salad. Okay? Even when some of them are barely washed. Also, what about the water that we drink? A lot of us still depend on tap water. Sometimes you could have a leakage, okay, that can actually contaminate waters that are going to our houses. Okay, so some of the things we need to do is to be careful with what we eat. On practical terms now, ensure that your water, all the water that you use for drinking purposes in your house are boiled, even if they come from tap. And some of the times, some other things that we may not even know, that some of these tap that get into our houses, some of our local wells that we have that are dug in our houses, you could also have flood coming in contact with such water. So by the time you use them to brush your teeth, you're exposed. By the time you use them to wash your vegetables, you're exposed, except you're still going to cook them. Okay, so depending on the environment where you find yourself, you must ensure that the water you drink, apart from that, the water you drink, sometimes too, we'll get into joints, I will say, please give me ice. Okay, so if this ice that you're using to make your drinks or put into your drinks to make them cold enough for you to drink, if they're from contaminated water, you will eventually be exposed to some of these things that we're talking about. So these are things that we usually do. You get into joints, we say smoothie this, smoothie that, they give you fruit juices. You're not sure how the preparation for those things were done. Okay, sometimes because we do them in commercial quantities for commercial purposes, hygienic practices are compromised in the making of those juices. And when you drink them, you get yourself exposed. So at a time like this, when we have an outbreak, I think people should be careful with what they eat. That is not to say that I'm asking you not to drink whatever you want to, but you need to be careful with what you take in. Also, the consumption of seafoods, unpasteurized milk, okay? These are other sources through which we can get this infection, okay? But we're talking about, it looks as if we're concentrating more on children because children are unable to take care of their hygienic practices. They always will have to depend on adults to help them out along that line. Okay, so that's why we are mentioning the ones that concern children the most, because as an adult, also for adults, our immunity is a lot more developed than it is in children. So they're more likely to get some of these diseases a lot more than an adult would do.
But it's not limited to children alone.
No, it's not limited to children alone. Okay, so it can occur on any age group in adults. Okay.
Okay, we're on transmission and...
Yes. So these are some of the areas through which we can get them. We've mentioned a good number of them. Okay, so currently what is happening now is that in Lagos State, the Lagos State Commissioner of Health, the Ministry of Health, alongside some other agencies and WHO, they've opened emergency operation centers where they're collecting data. Okay, so people who have been infected, that ensuring that distribution of drugs and all other consumables that are going to be used for their treatment, more than anything else, is the effort they are making to stop the further spread of this disease. Okay, so if you have somebody who is infected with it, you need to notify your medical officer of health in your locality or in your environment, so that by the time all these data are collected, they will use it to analyze and see where efforts are needed on what needs to be done. Okay, but instead of spreading fear and panic among the population, the best you can do is that if you have people who have these challenges, ensure that they are taken to the hospital on a good time. Okay, because my 8-year-old son was telling me yesterday when I came back that, Daddy, do you know about gastroenteritis, that he has killed a lot of people in Lagos. And they were told that those people were killed couldn't get to the hospital on time. In fact, that was the major reason why I had to actually consider
treating it.
Yes, postponing the topic we actually started last week so that we can look at this.
I think your son is current. That's what
so the paper was actually all over the paper.
But quickly, sir, I'd like to ask this question. The way you have painted this disease and the cure, does it go with quarantine system? Will they quarantine whoever is under treatment?
No. You don't need to quarantine anybody when it has to do with gastroenteritis. What you need to do is to ensure that In hospitals, we'll talk about universal precaution because some of these things can infect healthcare givers. Okay, we talk about barrier nursing. Okay, so you need to ensure that you use personal protective equipment if you're a healthcare giver and you're in a hospital setup, because they are very, like we said at the beginning, highly contagious and infectious disease. Okay, so but at home, what you can do is that if you have a child who is stooling and vomiting, ensure that the cup, the plates that you're using for that particular child are not used by your other children. Okay, because it can easily be transmitted from one child to the other. Okay, so we're not asking you to lock up your child in one particular room. No, he needs care, he needs love. Okay, but ensure that some of the things that he's using at that particular period that he's going through those challenges are allotted to him alone, so that some other children will not use them, because if they do, they can easily pick up the infection.
Okay, so as a parent, I'll quickly ask this before you continue. We know that when things happen like this and we start administering treatment, let me call it first aid treatment, in medical line they say if symptoms persist after 2 days. The issue of a child stooling and vomiting, do we also have that time? Do we have that permission to keep the child for up to 2 days while we're administering our first aid, or what is the time space that we have to rush to the hospital?
Thank you very much for that very good question. When a child is stooling and vomiting, honestly, there's not much a mother or a father can do at home, okay? Because some of the times, the vomiting aspect is the most worrisome aspect, because you won't be able to do the rehydration that you need to do, in the sense that you won't be able to give ORT. We have Lydia from Kogi. Lydia, good morning.
Good morning, sir.
How are you doing?
I'm good, sir.
The doctor is here. Please go ahead with your question.
All right.
Lydia, do we still have you? I think she's
Good morning.
Yeah, good morning.
Okay. Can you speak up and just
We can
go on
hear
your
you, Lydia.
question? Oh, sorry. She calls her back. Okay, so you're on his question. Are you on his?
Yes.
that you cannot replace lost water.
Yes. Now, the mainstay of treatment for somebody who is stooling and vomiting is to prevent dehydration. And that you can do by rehydration. Now, how do you do rehydration? If the child is not vomiting, you can give ORT, oral rehydration therapy or solution. You can also add zinc supplementation. But that is when the child is not vomiting. Now, when vomiting sets in, and then you give some antiemetic agents, drugs that can stop vomiting. You can give a drug like promethazine, okay? You have it in injectable and, of course, in tablet forms, preparations. Okay, so by the time you try that in the home front and the vomiting is not abating, please don't wait until the 2 days. It's not a benchmark. Quickly get your child to a hospital so that intravenous administration of fluids can be done. The child will be put on drip. That's what it means. Different type of drip, okay, are usually needed, okay? Don't wait until after 2 days before you go and see your doctor. Yes, because things can go so fast.
Dramatically, things can fall apart.
Yes, so fast because of dehydration. Okay, so how are the diagnosis of gastroenteritis made? Okay, usually in a medical, in a hospital setting, we don't usually channel our energies into investigations along that line, except in situations where you have epidemic outbreak. Okay, now the reason is that if you're taking a stool and you want to send for stool culture, it will take days before you can get the result. By the time you're getting your result, the child may have lost the patient. Okay, so the treatment is usually the same. Once it has to do with stooling and vomiting, the treatment is essentially the same. What that individual will benefit from is rehydration. In the hospital setup, you will give intravenous infusions. Okay, antibiotics is not usually indicated. I will say that again. I said that before. Antibiotics is not usually indicated. So for our mothers, usually when they have the children vomiting and stooling, we have Honor from FCT. Honor, good morning.
Good morning.
How are you doing, sir?
I'm fine.
Okay, to your question, sir.
Please, I heard a doctor talking about feeding bottle that parents, nursing mothers should avoid using. Fine. Okay. I heard a doctor talking about parents and nursing mother to avoid using feeding bottle instead of
cup and spoon,
because he was talking about the cleanliness of the feeding bottle. My concern is about children going to school with a water bottle. Is it also advisable? Because sometimes the straw in the water bottle also cannot be washed very well. So what about the water bottle? Should parents also avoid using water bottle at this moment that we have these challenges?
I agree with you. Spot on, sir. 100%. You're very correct, sir. Yes, the use of water bottles. What applies for feeding bottles should ideally apply for water bottles. Okay, but I know in some schools they have some good sources of water. I don't want to mention particular names now. They have good sources of water that children can drink from. I know it's not in all schools that children will have to go with water bottles. But at this time, if you're when we're having an outbreak, depending on the part of the country where you're located, it's important to avoid that. Also, if you must use water bottle too, you must have multiple number of water bottles so that at least you can clean and keep, okay, so that the child don't have to be using one always and always. But for mothers who still want to insist or who still insist they want to use feeding bottles, there is a way out, okay? We usually advise that you should keep in mind if you're a nursing mother and you're nursing a baby, you should keep in mind that you may have to use as many as 12 to 14 feeding bottles in one day. Once you use any one to feed the child, you cannot use it again. Once you feed the child and you drop it for some few minutes, you cannot, because even exposing the sucking surface after a while could be an avenue for the thing to get contaminated. So you use one, you drop, you pick a fresh one and use, and it's a lot of work.
Let me throw in line with his question, sir. The issue of feeding bottle, I've seen some nursing mothers whereby after feeding they use very hot water to wash the feeding bottle. In fact, some leave it inside the hot water. Can this actually can it provide any remedy?
Yes, it can provide some remedy. It's left in. So, okay, we have Daniel. We'll come back to your question, sir. Daniel, good morning, sir.
Good morning, Daniel. You gone? Call us back.
Okay, so yes, some
can
of these
can those rotavirus survive in hot water?
Yes, some of these viruses can actually survive the temperature of boiling water.
Whoa.
Okay, apart from use of heat now to disinfect, you can also use chemical disinfection. Okay, when we were small, I used to see one particular fluid that they usually pour into. I can't remember.
Is it into water?
Yes, I don't know.
Would it be chlorine or something?
And something like that. But what I can remember is the brand name, which of course I'm not going to mention here.
Okay.
But I don't know the chemical component anymore. Okay, so but in terms of diagnosis, once a child is stooling and vomiting, what you need to do if the child gets to the hospital is simple, basic blood workup. Okay, you may also need to see if this child has issues with the kidney. So you need to do serum EU and creatinine. You need to do a full blood count. Of course, the mainstay of treatment is to correct dehydration if that has set in already. The use of antibiotics, we said at the beginning, is usually indicated only when the child has fever or is passing bloody stool. That's only when you can use antibiotics. Otherwise, you need to make do with supportive therapy, because most of the time the cause is virus. And if it is virus, it can be self-limiting. So the use of metronidazole, as some of our mothers will always do, will not help in this regard. Okay, so but our take home in all that we're talking about is, number one, know today that whenever you have a child that is stooling and vomiting, your mainstay of treatment should be to rehydrate that child, not to stop the stooling. We don't stop stooling in pediatric age group, because if you do, it can cause some other complications, okay, which you may not even notice and which may require the child to go for surgery.
Okay, thank you very much, Dr. Bat, for the wonderful delivery on infectious diarrhea. From every one of us here, we say thank you very much, goodbye, and have a lovely weekend.